Hi everybody, I'm Gail Janicola. I am lovingly known as the Mommy Mentor. I have been serving and supporting moms-to-be and their partners for 26 years as a childbirth instructor and a doula. I'm also a doula trainer. So I wanted to talk to you about why it is so important to take control of your own pregnancy and the planning of your own birth, and not just to rely on your medical caregivers. Which is to say that you should not rely on your medical caregivers for the role that they play in your journey through this process, but they have a role and you have a role. So what's really important to remember is that, first of all, what's happening to you is happening to your body, which is different than anybody else's body. So although there are some standard, uniform things that happen in pregnancy to pregnant women, you are going to have an experience that is unique to you. So paying attention to what's happening to you, understanding the signals that your body gives you, that's all incredibly important as far as physiology is concerned. But then on the other hand, there's also this understanding that you know what's best for you. And I think we get that in almost every other part of our lives, but when we talk about pregnancy and birth, and especially anything that has a medical undertone to it. So I say that because pregnancy and birth is not necessarily a medical event, but we are being followed by medical caregivers as diagnosticians and people who will find things if things need to be found that can be important for us to know about so that we can have the safest and the most healthy pregnancy and birth. But you play such a big part in this because only you know what's best for you. So the most important thing, of course, is to become educated, to have information that you know is factual and truthful, but then to take that information and combine it with what is important to you, what your values are, what you, again, know to be best for you. That is what is going to make for the safest and healthiest pregnancy experience and birth experience. When you take control of your experiences, when you take control of pregnancy and birth, what you're doing is you are essentially creating a partnership with your medical caregivers. So again, you're not pushing them to the side. This is not one way or the other way. We're not swinging the pendulum from one side to the other side. What I'm saying is that instead of assuming that somebody, including your doctor or your midwife, the nurses that will be attending to you during your birth, know what's best for you, I want you to remember that you are able to make these choices yourself. You just, again, need the instruction, you need the information. But once you have that information and you combine it with your values and what's important to you, you are going to be able to create the best experience for you. What a lot of people don't realize is that there are many, many options, that they don't have to necessarily have a baby the way that their friend is having their baby or the way their mother had their baby. So you get to make those choices. So the important thing is that you set yourself up in order to make those choices and then work as partners with your caregivers so that you can hear what they're saying, take their advice, and then come back with your own explanations of why something is important to you, and through your research, what you found to be true, and how you would like to have this pregnancy unfold and have your birth become what it is that you want it to be. And you have the right to do that, and you really have the need to do that if your ultimate goal is to have the best experience possible.